Hi, I'm Megan Carey, and my project is on ultrasound. Sonography, often referred to as ultrasound, uses high-frequency sound waves to create an image. Ultrasound is a wave of moving molecules that requires matter, which differs from typical X-ray. Radiation moves through a vacuum, whereas sound waves can only move through matter. Sound waves are vibrations that move through matter, but if there is no material, there is nothing to vibrate, so no sound can exist. Sonography moved to medicine in the 1940s after physicians realized how it could be used in the human body. Next, I'm going to describe how ultrasound works. Ultrasound requires several components to produce an image: a transducer, ultrasound beam, and a place to display the image, such as the cathode ray tube or video monitor, are required to yield an ultrasound image. The transducer is used to transmit sound impulses and to sense echoes returning from the pulses. Each echo that returns adds to the developing image. Sound waves are formed in the transducer by a vibrating crystal. The transducer contact with the body leads the crystals that vibrate to make the particles in the body to vibrate. These vibrations then move between tissue layers. Ultrasound pulse reflections develop at the border between two body structures. As ultrasound pulses move through the body, it loses energy, which differs from the X-ray photons, where energy is lost all at once. To continue, now I'm going to talk about the variety of instruments used in ultrasound. There are a variety of instruments used in ultrasound. There are different transducers: high, medium, and low frequency. High-frequency transducers have a frequency of a range of 7.0 to 14.0 megahertz. Linear transducers are primarily used, but sector transducers are more appropriate when using with pediatric patients. High-frequency transducers provide increased resolution of images with reduced penetration. Linear probes are most appropriate to use when evaluating superficial structures. Medium frequency transducer range in frequency from 3.0 to 5.0. These transducers are curvilinear or sector and most commonly to use for abdominal imaging in adults. Low frequency transducers have a frequency of 2.0. This transducer is a sector type and offer increased depth of penetration but does cause loss of resolution. This type of transducer is typically used for evaluating obese patients. The linear tray transducer is optimal for superficial structures such as testes, vessels, and the neck. The produced image is viewed as a rectangle. The curvilinear tray transducer is typically used in abdominal and pelvic imaging. The produced image is arranged as a convex arc. The phased array transducer is optimal for cardiac imaging. This transducer has the advantage of offering a broad image area, higher depths. There are three types of mechanical scanners: oscillating transducer, unenclosed, oscillating transducer enclosed, and rotating wheel transducer. Doppler instruments show blood flow, direction of blood flow, and type of blood flow. Continuous wave Doppler is used when evaluating peripheral vessels and the fetal heart. This type of Doppler gives information in blood flow but does not provide information on the depth of the signal. The pulse Doppler produces a short sound wave burst. This offers information on the presence, direction, and depth of the Doppler signal but does not offer information on the intensity of the signal. The power Doppler shows the intensity of the Doppler signal but does not provide information on the velocity. This type of Doppler has superior flow sensitivity and is used to inspect the presence and characteristics of blood flow. Harmonic signals are also used in sonography by signals generating in the body as tissue or contrast agents interact. Harmonic signals are narrow and have lower. Harmonic signals are often used to differentiate between cystic and solid hepatic lesions. Finally, I'm going to explain what they are and the differences between anechoic, hyperechoic, hypoechoic, and isoechoic. Anechoic is the absence of an echo, which is seen when the bladder is filled with urine and cannot produce an echo. This will show black on the screen. Hyperechoic is seen as a white on the screen and may be a liver lesion, for instance. Hypoechoic is seen as gray on the screen. Most breast lesions are seen as hypoechoic. Isoechoic is a mass located in a fatty tissue and will typically be seen as homogeneous. Ultrasound is often used in pregnancy, diagnosing cardiovascular problems, examining the abdominal area, and investigating the liver, for example. And that's the end of my video. I hope you enjoyed my video, my presentation. See you next time.